Good afternoon, everyone. During the month of Ramzan, we offer prayers and duas and recite Quran Majid. So, इना वास्ते अपना से ज़रूरी सूच है कि अपने अपनू मुंह, that is the mouth and oral hygiene maintain करिए, because that is the pathway through which we will be reciting Quran Majid and offering prayers. So, in continuation to our series on how to stay healthy during Ramadan, today we have with us our senior most and the most esteemed dentist, Dr. Kalpana, with us, and she will be sharing few tips on how we can keep our oral health and maintain cleanliness of our mouth during the month of Ramzan. So just give me a minute as Dr. Kalpana joins us. Okay. A very good afternoon, Dr. Kalpana.
Good afternoon, Fatima.
Okay. So, Dr. Kalpana, thank you for joining us today, and we would like you to share with our viewers some health tips that you can give them how to keep their oral health and hygiene during the month of Ramadan.
Thank you, Dr. Fatima. So, good evening to one and all present here. Today, I, Dr. Kalpana, will be citing few tips and tricks to all of you, which you can follow in the month of Ramadan, so that your oral care is taken care of in a very good way. I will be sharing few tips in the initial part, and then we can have a Q&A session with Fatima Bin. She'll ask few questions, or you can ask me some questions when we are going live, and I can answer them as much as I can do. So let's start with the tips and tricks. So as the month of Ramadan is a holy month in which you all are fasting for a duration of 28 to 30 days. So it does have a good impact in your rest of the whole year. Similarly, those fasting can cause a good or bad impact on your oral health as well. So as you guys are fasting for a longer duration, it alters with your lifestyle routine, that your sleep hours gets altered. You take care of your daily regime in a different way. So that's how your routine of oral care is also get affected. Many a times the shifting of your meals are drifted to 2 peak of the hours. Means you guys have early morning before the dawn comes, you guys eat, and later after the sunset you guys break your fast and you have your meals. So oral care, today I will be deciding in the 4 main major sections. First will be the diet, which you guys have to follow so that your oral care is taken care of. Second most part will be the hydration, the level of water you should drink so that the flow of saliva in your mouth is taken care of. Third will be the lifestyle or the immunocompromised patients, few tricks from them also, so that their hydration and the level of oral care is kept in mind. And fourth will be the 4 major tips and tricks you can follow for your brushing or flossing part so that your oral care is taken care of. So let's start with the first point, that is diet. So I would always request everybody, in routine days we always say that don't skip your breakfast. Similarly, you should not skip your suhoor. That is the first meal you guys have before your fasting starts. Why? Because for next 14 or 15 hours, you guys are going to be in a state of fasting. You don't even take your saliva inside. So your body is definitely going to be a state of dehydration. So to prevent that and to guide your gut and intestine, that you have to maintain that water maintenance in your body, you should have good drinks, or I would say have a good date shake so that it keeps your sugar level as well as the hydration in a proper maintenance period of phase, or so that next 14 to 15 hours are kept in mind. Have a good portion of protein rich salad, like you can have legumes, you can have green chana or salads, so that your proteins are in my body, so that you're less carving for the carbonated drinks or carbohydrates for your body won't require. Because more of protein if you take in your diet, your bacteria load on the mouth will start converting it to the easy saturated proteins, so that your body is functioning more to digest it for a longer time, so you feel fuller for more number of duration. High intake of proteins also help in excess flow of saliva, and it prevents your body from having a bad mouth. Many patients comes to me during the phase of Ramadan telling me that, ma'am, we are not feeling good because we are facing a issue of foul odor. That comes because longer duration of dehydration of your mouth causing dryness of mouth, that goes in your tongue in a state of dryness, which leads to the dryness of gums. Then dryness of gums causes sponginess, that leads to bleeding gums, and that causes foul odor. So keeping your diet in control. Then second point was hydration. At least we say that whatever is your body weight, at least you should have 1 liter over the 20 kgs of your body weight and divide it as much as weight you are. Suppose you are a 60 kg weighing person, so you should have at least 3 or 3 plus liters of water in a day. But when you are fasting around 1/3 of 2/3 of a day, it is not possible that you keep yourself so much hydrated on those hours. So what I would say is, when you are not in a fasting phase, means after your iftar, when you have broken your fast, I would suggest every 1 hour at least have 1 to 1.5 glass of plain water. Many people go into having a chia seeds water or lemon water or something which is more on a citrus part. That is good, but keeping yourself more on citric side or on acidic side also causes irritation. Initially you will feel good because your body will be converting it into a good hydration state, but what happens is, even after a day or two, then you will say that sourness of mouth is happening, teeth are getting irritated when we are having excess of sugary things or we are having baked items. What happens is your body in teeth enamel gets start eroding when you are having more of a lemon or citrus food, because that fasting causes dryness of your teeth. So more of citrus intake that time also causes minor cracks on the teeth, and then you complain of that we are having sensitivity on having the sour things or extra sweet things. So this is about hydration. Try to take freshly made soups, juices, or I would suggest take most of smoothies. Smoothies that too have milk. And those who are lactose intolerant, I would suggest that you can go for tender coconut water, or you can opt for, now the season is good, we have watermelon supply vividly, so you can go for watermelon smoothies. That itself is a natural sweetener, and that gives more hydration to your body. And in form of salads, you can focus more on things which are more in water content, like you can go for cucumber, cabbage, and you can even use the radish and what we call carrot for your dressing purpose, and you can use them for your diet plan. So 2 factors we have covered, that is diet and hydration. Now we'll go to the third factor, that is lifestyle modification. In these category, I would divide us into 2 major parts: those who are having some habits and those who are in a state of immunocompromised situation. Immunocompromised situations are like those who have comorbidities along with them, like heart patients, renal patients, or any disorders patients. It is always said that those who are affected with any heart or renal issues, they should avoid more of fried items, like heavily cooked in oil or ghee items. Why? Because that contains bad cholesterol. So in those cases, I would suggest, if you can't skip fried food items during the month of Ramadan, try to use healthy oils like canola oil or coconut oil for doing it. And instead of deep frying or heavily frying them, if possible, try to use pan fry. And if you can use an air fryer, nowadays it is vividly available, it is the best option, so that your itself intake of oil is getting reduced. Then come to the stage of those who are immunocompromised, to nahi kahenge unko, like those who are denture bearers or implant bearers in the case of dentistry. See, denture bearers, what they suffer from the issue is, because of long fasting hours, there is dryness of mouth. So after 10 or 12 days of fasting, denture bearers come to us and they start, अभी में हम लोग dentures पहन रहे हैं ना, तो हमको irritation हो रहा है, or they come with a full redness of mouth, full of ulcers. Why that happens is because the dentures which they are wearing, they are in contact of a dry skin or dyed gums for a longer duration. So whenever they talk or they try to eat, it causes rigid pressure on the dried skin. If we have a dry skin, if we natch it out, so we can see scaling on the skin also when it does. So same thing happens when you are fasting for a longer duration. Your gums will go into a state of dehydration, and over the top, if you are using a denture without proper lubrication, it will start irritating your gums, and that will lead to dryness of the mouth, and then it causes irritation while you are wearing dentures. So for denture bearers, whenever you are about to open your fast, I would always suggest to first clean your dentures with a good antiseptic or a good cleaning solution readily available over the counters on medical shops. Use it and clean it and then wear it. And before starting your meals also, I would just suggest you to swish your mouth with a good water content, or if possible, do the oil pulling. What is oil pulling? Oil pulling is something which I would advise for everybody to at least have it as a first habit in the morning hours. What you have to do is take 5 to 7 ml of coconut oil or virgin or olive oil, whatever you can use for your cooking purpose, you can take it, keep it inside your mouth and keep it swishing for at least 10 to 15 minutes, and then you can spit out. After spitting out, wait for a minute or two, swirl your tongue all over your teeth and gums, feel the lubrication it has given to your oral cavity, and after that, if you want, you can brush your teeth. What it does is it will always flourish your gums and it will prevent your mouth from getting dehydrated. So oil pulling is something you can try and you yourself will feel the changes. Second, those who are using implants or those who have implant supported dentures, it is must and mandatory that after your meals, after your iftar meals, you do a good brushing with your fluoridated toothpaste, and must is the use of mouthwash. Many of the patients from your committee always come and tell me, "Ma'am, sugar free hona chahiye, alcohol free hona chahiye." Luckily, now in market, maximum brands are sugar free and alcohol free of mouthwashes, and now we have good flavors also. Mine favorite is a fresh tea flavor. Tea is something which nobody avoids, and those who even avoid also, they can also use this flavor of mouthwash, and you can rinse your mouth with that, so that dryness of mouth or bacterial load which has caused because of dryness will get subtracted out from your oral cavity. And the last thing which I would suggest is the oral care tips. 5 points to be taken care of. First thing, you have to brush your teeth twice daily. In a routine day, we tell it to be morning. First thing to be done is your brushing, and night before you sleep is to be brushing. For the days of Ramadan, I would say before you take your suhoor meals, try to brush your teeth first. Or else, if you don't want to do that, keep it the last thing you do after having your meal, so that your cleaning of the teeth is done, and for next 14 to 15 hours, there is no food stuff left over the surface of tooth for the bacteria buildup to happen. And before you go to sleep, after your iftar is done or you're going to sleep, keep first thing in mind that before going to sleep, you should do brushing. Second thing, people don't follow this tip is to floss your teeth. I know it becomes clumsy for a lot of people to do floss every day, but what I suggest is, if it is not possible for you all to floss at least every day, keep it a routine of an alternate day, or at least keep it thrice a week, so that it will not allow 70% of plaque buildup to happen in your mouth. The longer the duration the plaque will be staying on the teeth, it will lead to the formation of tartar, and that it itself will become the state of bad mouth in your oral cavity. So if you are keeping flossing and brushing in mind, it will help best to you. So now, Fatima, ma'am, if you have any questions, we can go ahead with them.
Definitely. I wanted to know that fasting during Ramadan, does it have any negative effect or any impact on the overall oral and dental health?
Yes, as I told you in the initial part, because your body goes into a fasting phase of around 14 to 15 hours. That is a phase, even in summers, if we are out for an hour or two, we feel dryness of mouth. So imagine you are going into a stage of fasting for 14 to 15 hours. What your body does is, it doesn't have a, what we can coding, body doesn't have a coding that right now you are fasting because that is why you are having a dryness of mouth. Body is having a gates for balancing the water. So that time the saliva you are not taking inside or having inside, because your body is trying to compensate water levels to the other vital organs, like your renal body, perspiration of body, sweating happens. So water level goes wane in that. So for those time, dryness of mouth leads to the dryness of gums, excess load of bacteria build up in that, and that itself leads to the tooth decay or bad mouth in the oral cavity.
So most people have this problem, bleeding gums, and as you said, that foul odor from the mouth. So what can one do to, get rid of them completely?
Yes, as I told you, because there is less level of water inside the mouth, what it causes is dryness of mouth. First, your tongue will start getting dried up. Then you will feel like itching or reddishness around your gums. Then if you feel it, you will feel that even on tender touch, you will feel like teeth nahi, gums are aching a bit. So that is all because that stage has gone to the gingivitis. What is gingivitis? Gingivitis is inflammation of gingiva. Gingiva is your gum part. So whenever your gums are getting spongy, ready, or even while you're brushing, you feel like bleeding of gums thigh shape. Means your blood, when you are trying to spit out, there is tiny amount of blood coming while spitting out. That is a stage which we call as gingivitis. So that is a preliminary marker that this Ramazan fasting is affecting your gums. So keep that in mind. Keep yourself in a more phase of hydration. Circumvent your less water intake by non-fasting hours. Try to keep yourself hydrated so that the gums and oral cavity is flourished and there is no phase of dehydration.
Definitely. Okay, we have a question from one of our viewers that is oil
Yeah.
rinsing advisable routinely or only during routinely? That is also when you're not fasting.
No, it is a good thing. You can use it. Means I, being a dentist myself, I do it on a regular basis. But even I skip it once or twice because of the hectic schedule. But you can use it as a daily routine regime. Just keep it in mind that you use healthy oil. Don't use ghee or any other alternative. Try to use virgin olive oil or with a good coconut oil. That is the most healthy way to follow this regime.
Okay, so as we know that teeth, are the first step towards the healthier you, because what food we eat depends
Yes.
on the quality and the health of your teeth. And as you have very well given us few inputs on what to eat and what not to eat to maintain
Yeah.
the health of our
Yeah.
teeth,
Yeah.
just एक last नंदरे का नानू सु हम एक end of session कर लिए अपने about foods that
Yes.
people can eat and what they shouldn't eat during Ramadan to maintain the health of their teeth.
Okay, so I would give you three heads that you should avoid. First thing is try to avoid things which are fried. Fried items should be avoided. Things high on sugar items should be avoided. Things which are more on spice or salt should be avoided. Now you people will tell you or telling us to avoid everything which we want to have. But you should have everything in a balance. Why? Because fried items will keep you fuller for a shorter duration, but on a longer span, you will feel like that keeping us full for a shorter duration, but we are feeling more thirsty more often. So that is what is happening when you are intaking high fried items. It will keep you fuller also for the shorter duration, and then you will feel more thirsty again and again. Why I am telling you to avoid sugary content? Because sugary content things will spike your blood glucose level immediately, and then you will feel like that you have eaten so much. So you will be fuller for a shorter duration, and then you will feel like अभी ये खा लेते हैं, अभी कुछ drinks पी लेते हैं. And mostly it happens whenever you have sweet things, now you will have more urges towards the caffeinated drinks or the carbonated drinks. Yes, and those two higher sugar and always causes dehydration. I always notice if you have a tea or a coffee, after 15 to 20 minutes, you will feel like pani pi lete hain. Or if you go to movie, if you have a popcorn, you will always feel like we should have a aerated drink also with that. So this is what your body is always tried to compensate the state of dehydration. And that is mind game that we go for a caffeinated drink or we go for a naturally made juices for that purpose. What we should avoid is things which I said, what we can include in our diet are things which are more on natural basis, like keep yourself hydrated, choose for options of keeping your water level with the best supplement available is natural form of water. If you are feeling like water is boring for a whole day, you can go for a tender coconut water. You can go for honey lemon. I will always suggest don't use only lemon water or chia lemon water. Always add honey because itself it's a nourishing element and it will give you lubricating effect. It will minimize the citrus impacts on your dental enamel and then it will help you in your overall nourishment. You can include probiotics. Probiotics in your diet like curd, buttermilk, kimchi. What it does is it gives us the good bacteria in our gut that itself fights with the bad bacteria and compensates the acidic level so that you don't have foul odor buildup or foul scents coming from your mouth. So these 3 to 4 items will help to keep yourself hydrated as well as fuller for the more duration of time and keeping your oral care also in the prim proper place.
So there is one question that sometimes when we eat dates, it doesn't feel very good, in the mouth. So I think that is something you answered already in the live, that because of the dryness of the gum, maybe.
Yeah, usually I'm not aware so much of the diet you guys follow, but I know the dates is the preliminary thing which you guys
First thing
do.
that we break fast with, right?
Yeah. So is it possible that keeping it out directly from the box, you can keep it in a bowl of water so that the topmost layer of the date is not dried, and it will also get moistened up, and it will become easy for you also to chew, and it will keep you fuller for the mouth, because dryness of the date over the dates, it is what more chaotic for you to have initially. Yeah.
Wonderful, wonderful. Thank you so much, Dr. Kalpana, for sharing all your advice and inputs with us. So
Yes.
we wish all our viewers have a healthy and fit Ramadan. So now,
Yes. Definitely.
anyone who has missed today's live, you can share we will be sharing the video on our page. So
Yes.
please share it with your friends in your group so that we can make more and more people can take benefit from this. As well as
Yes.
that, हमना जे भी Dr. Kalpana आपने कीधु, all the things that she shared with us, we will be converting it into a small post and sharing it on our
Yes.
page
We
as
will
well.
definitely share
So
it.
be
Yes.
follow our page and be in touch with us. You can also ask any more questions that come up to us directly in our DMs, and we'll be happy to help
Yes,
you.
we'll try to answer them all. Yeah, definitely.
Definitely.
Thank you. Thank you everyone for joining.
Thank you everyone for joining. Bye bye. Thank you, Dr. Kalpana,
Bye.
once again.
Thank you, Dr. Fatima. Bye.
Bye.